I'm allergic to dairy, specifically the whey proteins. I had my first allergic reaction when I was, I think, around 2 years old. I had to go to the hospital due to anaphylaxis, and ever since then I've been avoiding milk, avoiding dairy in whatever form that it comes in. Depending on the different intake levels, I had to take different levels of epinephrine. Sometimes one wasn't enough, sometimes two wasn't enough, and it was at the point where any time that I took epinephrine, no matter how much I took, I would still have a rash all over my body for about like 24 hours after the reaction. I was homeschooled for elementary and middle school. My siblings, I have 6, went to a regular middle school, but because of my allergies, they decided that it was best I stay homeschooled. In high school, I always brought my own food, always. A lot of places that are producing massive amounts of food, they're not going to be able to sufficiently cater to people with food allergies. A time when I was around 10 or 11, I was on a group trip to Italy, and my mother had packed all of my food for me for the entire week and a half, 2 weeks that we were there. And I remember we were on the bus, in the middle of Tuscany, in the middle of nowhere, and I was hungry, so I had a protein drink. But the protein drink was not what we thought it was. The branding was switched up, so instead of being a plant-based protein shake, it was whey-based. And I immediately found out and felt in my body that something was wrong. The epinephrine held me over until we made it, I think it must have been like 40 minutes to the nearest hospital. Throughout the entire process, it was, am I gonna make it through? Is this gonna be the end? Because my body was just shutting down in every way possible. Because of my food allergy, a lot of times it was easier to just avoid any situation. Whether it's for a school event or a sports event with friends, and we were all gonna go out for food afterwards, I would always try to make up an excuse of why I can't, just to avoid eating, and just say, sorry guys, I'm busy, I can't. One day, my doctor told me that XOLAIR had been approved to treat food allergies. I still avoid milk, but if there's cross-contamination or it's accidentally cooked with butter instead of oil, XOLAIR can help reduce my food allergy reaction.
What is XOLAIR? XOLAIR, omalizumab for subcutaneous use, is an injectable prescription medicine used to treat food allergy in people 1 year of age and older to reduce allergic reactions that may occur after accidentally eating one or more foods to which you are allergic. While taking XOLAIR, you should continue to avoid all foods to which you are allergic. It is not known if XOLAIR is safe and effective in people with food allergy under 1 year of age. XOLAIR should not be used for the emergency treatment of any allergic reactions, including anaphylaxis. Important safety information. What is the most important information I should know about XOLAIR? Severe allergic reaction. A severe allergic reaction called anaphylaxis can happen when you receive XOLAIR. The reaction can occur after the first dose or after many doses. It may also occur right after a XOLAIR injection or days later. Anaphylaxis is a life-threatening condition and can lead to death. Go to the nearest emergency room right away if you have any of these symptoms of an allergic reaction: wheezing, shortness of breath, cough, chest tightness or trouble breathing, low blood pressure, dizziness, fainting, rapid or weak heartbeat, anxiety or feeling of impending doom, flushing, itching, hives or feeling warm, swelling of the throat or tongue, throat tightness, hoarse voice, or trouble swallowing. Your healthcare provider will monitor you closely for symptoms of an allergic reaction while you are receiving XOLAIR and for a period of time after treatment is initiated. Your healthcare provider should talk to you about getting medical treatment if you have symptoms of an allergic reaction. Do not receive and use XOLAIR if you are allergic to omalizumab or any of the ingredients in XOLAIR.
Actually, 2 weeks ago, my sister graduated college and we went out to eat. And we went to this restaurant and we told them, hey, I have these food allergies. Can you accommodate? And they said, yeah, sure. And then when I got my meal, I knew like a bite in that it had milk in it. So I stopped eating it. Kind of like the first time in my life that, I had this experience where things went wrong, but they didn't go so wrong.
Before receiving XOLAIR, tell your healthcare provider about all of your medical conditions, including if you have a latex allergy or any other allergies, such as seasonal allergies. The needle cap on the XOLAIR pre-filled syringe contains a type of natural rubber latex. Have sudden breathing problems, bronchospasm. Have ever had a severe allergic reaction called anaphylaxis. Have or have had a parasitic infection. Have or have had cancer. Are pregnant or plan to become pregnant. It is not known if XOLAIR may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if XOLAIR passes into your breast milk. Talk with your healthcare provider about the best way to feed your baby while you receive and use XOLAIR. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I receive and use XOLAIR? When starting treatment, XOLAIR should be given by your healthcare provider in a healthcare setting. If your healthcare provider decides that you or a caregiver may be able to give your own XOLAIR pre-filled syringe or auto-injector injections, you should receive training on the right way to prepare and inject XOLAIR. Do not try to inject XOLAIR until you have been shown the right way to give XOLAIR pre-filled syringe or auto-injector injections by a healthcare provider. Use XOLAIR exactly as prescribed by your healthcare provider. The XOLAIR auto-injector, all doses, is intended for use only in adults and adolescents aged 12 years and older. For children 12 years of age and older, XOLAIR pre-filled syringe or auto-injector may be self-injected under adult supervision. For children 1 to 11 years of age, XOLAIR pre-filled syringe should be injected by a caregiver. See the detailed instructions for use that comes with XOLAIR for information on the right way to prepare and inject XOLAIR. XOLAIR is given in 1 or more injections under the skin, subcutaneous, 1 time every 2 or 4 weeks. In people with food allergy, a blood test for a substance called IgE must be performed before starting XOLAIR to determine the appropriate dose and dosing frequency. Do not decrease or stop taking any of your food allergy medicine or allergen immunotherapy unless your healthcare providers tell you to. You may not see improvement in your symptoms right away after XOLAIR treatment. If your symptoms do not improve or get worse, call your healthcare provider. If you inject more XOLAIR than prescribed, call your healthcare provider right away. What are the possible side effects of XOLAIR? XOLAIR may cause serious side effects, including cancer. Cases of cancer were observed in some people who received XOLAIR, fever, muscle aches, and rash. Some people get these symptoms 1 to 5 days after receiving a XOLAIR injection. If you have any of these symptoms, call your healthcare provider. Parasitic infection. Some people who are at a high risk for parasite worm infections get a parasite infection after receiving XOLAIR. Your healthcare provider can test your stool to check if you have a parasite infection. Heart and circulation problems. Some people who receive XOLAIR have had chest pain, heart attack, blood clots in the lungs or legs, or temporary symptoms of weakness on one side of the body, slurred speech, or altered vision. It is not known whether these are caused by XOLAIR. The most common side effects of XOLAIR in people with food allergy: injection site reactions and fever. These are not all the possible side effects of XOLAIR. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Genentech at 888-835-2555 or Novartis Pharmaceuticals Corporation at 888-669-6682. Please see full prescribing information, including medication guide, for additional important safety information.